Okay, looks like we've had a few more people join us. So good morning, everyone. We're going to talk today about why Medicare Compare USA. Why does it make sense for you to be working with Medicare Compare USA? I know a lot of people on this webinar are working for Medicare Compare USA currently, and I think we may have some folks that are not currently working for us. So we're just here to reinforce why it's a good idea to partner with Medicare Compare USA. So thank you for joining our session today and learning more about us. I'm going to wait and take questions at the very end. This isn't going to be a very long webinar. We're going to make it concise and to the point. So working with Medicare Compare USA means you're working with a company created by pioneers in our industry. Our leaders and founders of our company professionally grew up with a sole focus on Medicare insurance plans and distribution systems for them. They have actually traversed the country in the early days talking with providers to determine whether there was a need for the type of service that we offer in the form of a Medicare insurance helpline. So we were built on talking with providers on a national level, engaging them in our conversations to determine whether our services were needed across the country. And it was an overwhelming yes, that our services are needed. Hospitals, although they're well-meaning and their representatives are well-meaning, they oftentimes try to give out insurance advice that may or may not be correct. And so that creates a compliance issue with our hospitals, which is why they turn to us. We are the industry leader. We know how to help them manage their Medicare populations. And we have contracted partnerships with major hospital and health systems from Washington to Florida and in between. The advantages to the agent community, there are many. We are contracted with most of the major carriers across the United States. We have participating in a T65 program, which allows folks approaching Medicare to establish a relationship with you early so you can foster your relationships while guiding the T65 from enrolling in Part B all the way to plan choices and enrollments. Our esteemed agents also have the opportunity to join our agent ambassador program, and our ambassadors work closely with our provider contracted health systems. The advantages to the providers that work with us are many. They do trust our agent ambassadors to carry their message regarding what plans they participate with. Our ambassadors also provide patient education and staff education for our providers. Never before has the provider community had such a trusted resource. This affords our providers the freedom to cancel a Medicare Advantage contract if they want to, knowing that they have trusted agents to enroll their patients into plans that will be in their network. As an agent, you're sitting there just taking appointments and it's really just gravy. As an advantage to the provider community, we also have great advantages in that scenario for the agents. Our back office support, our call center is in Bellingham, Washington, and they provide tremendous support. A lot of them are licensed agents who can assist patients with non-sales related questions. When somebody calls into our call center, they can schedule an appointment directly onto the agent's calendar. We do believe that when we can schedule an appointment directly onto the agent's calendar, the chance of a sale increases. And oftentimes when you're given someone to call, it might be hard to make a connection. So they're calling first, kind of warming up that person, scheduling the appointment directly onto your calendar as an agent is really helpful in your ability to be able to close that lead. They'll also send out the scope of appointments forms for signatures prior to your appointment. They normally do this via email, but they can also do snail mail depending on the capabilities of the person calling in. They'll also capture those return scope of appointments and get them right to you when they come in. whether they come in via the email system or hard copy. And they also will assist in coordination of provider-sponsored seminars. A lot of our provider clients like to have us in there giving seminars and educating their folks right on their campus. Reports, book of business reports. These are really helpful to have. We can provide a report that has the email or snail mail address in it. We can also provide content for your email communication. Last year, just as an example, we sent out an email communication regarding COVID, letting folks know that their testing and treatments were going to be covered by Medicare. Personally, I got a huge response of appreciation from the folks I emailed. And it was just a great time to let them know I'm thinking about you, I care about you. And the email was all written from our office. So I really didn't have to worry about, am I being compliant? Am I saying the right thing? They really helped with creating that email that we could use. AEP retention prep. We want our folks to come in for an annual visit, so we can send a mail or email to our customers reminding them. The company normally sends out a letter every year, but you can reinforce that by sending out your own letter or emails. And anything you do send out, we want you to run by our compliance officer and make sure that everything is legal there. Marketing support. We have a girl. I don't know if you've heard of Crystal, but she's great at helping to create pieces, working with you on co-op mailings, ongoing social media campaigns, really help with national name recognition. I know that in my Facebook, I get that email or that Facebook announcement occasionally from Medicare Compare USA, letting us know what's new, what's going on, reminders. And I find that sharing that content really helps my Facebook friends know that I'm in this industry and I'm there waiting to help. And I don't even say anything. I just simply share the content. We also have internal support for flyers, co-branded rack cards, other marketing pieces, swag pieces, and we will work with you to help you to grow your business. So contracting support, we have a gal for that. If you've heard of Polly, she's fantastic, and she's going to make your contracting and appointments go smoothly for you. She knows that stuff from top to bottom, and she's there to help. Moving right along. The agent leads portal, we have a contact database for you to receive and track your leads and sales. This is a great tool to keep you organized and make sure that you don't miss out on receiving a lead. You can go in and you can create your own lead, or if one comes into the call center, they can create one for you. And this allows the dispositions of leads to be entered within the portal, alleviating extra steps. I know since I've been using the agent leads portal, my paper has gone way down. I don't need to print as much. I don't need to have that result of appointment form completed. I can just put the information into the leads portal and it automatically gets communicated to those that need it. They also, the leads portal will give you email and text alerts when you have a new assignment. Our agent sales portal, many of you may have used the CSG or the Sunfire tool. These are online systems for completing your sale. They allow you to complete the scope of appointment, also to do plan comparisons and enrollments. The contact data management tool helps you to keep track of your leads and your customer contact data. I know this is short and sweet, but I think I've covered a lot in 12 minutes. So I want to thank you for attending with me today. And I can certainly open it up. If you have any questions, you can put them right into the Q&A box. I don't see any, but I'll give it a few more minutes. So I'll just reiterate, for, marketing co-op information, you can go to Crystal Garcia or work through Alex for appointments, appointment questions, licensing. That's Polly. We've got some great resources, and I would encourage you to use them. Okay, well, I guess it's a wrap. I don't see any questions, and you all have a great day.